Good. Well, this is just a session on last minute tips and things like that. And most of you probably have already started revising. So basically what this session aims to do is just give you some last minute tips, advice on how to go through each section, and then just how to revise. Basically, that's what the session's on. And then at the end, I'll have a little bit of a Q&A. Where we can either talk about, if you have any questions related to UCAT, we can talk about that. Or if you have any questions related to any aspect of the medical school application, please post your questions for that as well. And then I'll try and answer them as best as I can. Okay, so I think I'll get started because it's 2:01. If anybody else is joining, they can join in as they come. I've disabled the waiting room, so that should be fine. As I said before, this presentation is on last minute tips and advice. So a little bit of an overview about who SixMed is. It's a company that was created by medical students for medical students, and we've taught over 10,000 students in the past 6 years. The kind of support we offer is these surgery webinars where you can come and find out a little bit more about things like the UCAT, BMAT, and personal statements and work experience. And then the other ones are, the other kind of events that we do are large scale sort of UCAT courses, which is a day course, and same for BMAT and for personal statements as well on a Saturday. And then we also offer interview preparation later on in the year. So from end of October onwards, when you guys start getting your interview offers. So we basically take you through the entire medical school application process and offer support at each section, basically. This can be in large group, or it can be one-to-one as well with a tutor like me, for example. So that was just a little bit about the company. A little bit about myself. I'm a 4th year medical student at Bristol. I've just finished intercalating, which is a 1-year research year degree, which many of you might know about, at Imperial, and I'm going back to Bristol for my last 2 years of medical school. I am quite passionate about teaching, which is why I do these sorts of events, and I have an interest in surgery at the moment, so that's what I'm aiming to do in the future. So we have a lot to cover. So the first bit I'm going to talk through is just go through an overview of the UCAT, basically, which might have been covered in your last session if some of you came to last Sunday's session, which was done by Ella. And it's just covering sort of a general admin in case you still haven't applied for the UCAT and you still don't know much about it, or if you're a year 12 student who will be applying next year, that's a bit of useful advice for you guys. Then just a little bit of general advice about how to approach the UCAT exam, and then specific tips for each section. So for verbal reasoning, decision making, quantitative reasoning, abstract reasoning, situational judgment. And then finally, we'll do a little Q&A. Someone, sorry, just before I move on to the next one, someone's just raised their hand. Was that an accident, or did you want to ask a question? Just pop it in the chat if you have a question, and I'll just wait for a few minutes if you did have anything that you wanted to ask. I'll move on to the next slide if you want to type in your question, or if it was just an accident, it's absolutely fine, don't worry about it. Oh, someone said something in the chat. What is the score that unis require for the UCAT? It varies between universities. It depends really where you're applying to. And the unis across, so your medical school application consists of your personal statement, your UCAT score, and your predicted grades for your A-levels and your GCSE grades, doesn't it? All of these 4 aspects of your medical school application, they will give each section a mark, basically, and you'll get an overall mark for your medical school application. Each individual will. And then based on who scores the highest in that, they will then invite you for interviews. So it's not just about the UCAT, it's a combination of all different parts of your medical school application. But the way they weight it, so whether they think UCAT is more important than personal statement, or whether your GCSE and predicted A-level grades are more important than your UCAT, is really dependent on which university you apply to. I don't know the specifics for each university, but if you go on to the universities that you want to apply to, if you go onto their medicine page, their medicine degree page, they should tell you what they're doing for the 2022 to 2023 cycle. And that way you'll be able to see how much weight they put on the UCAT mark versus something else, for example. There's another question. Did you go into medical school straight from college, or did you do a degree first? So I went straight from A levels, so from sixth form. And then I've done first year, second year, third year at Bristol. And then between third and fourth year, so my last year, I studied in Imperial for a year, where you do something called an intercalation, which is a research year. So that's what I did. And then I have 2 more years left of medicine. So I went straight from school. Okay, I will park the rest of the questions for now. If there are any more, keep posting them in the chat, but I'll continue on with my slides. So just a little bit of housekeeping. Make sure your mics are muted so that you are avoiding any disruptions. The session, I'll try to make it as interactive as possible. So when I ask questions, if you guys want to type your answers in the chat, for example, and also feel free to post questions during the session. Now, this kind of last minute tips and advice session is more of sort of a 1 hour Q&A rather than sort of doing UCAT questions itself. So feel free to keep posting questions in the chat and I'll address them as I go. So just to test the chat function as well, if everyone could type the number 1, 2, 3, or 4 in the chat. So on a scale of 1 to 4, how confident do you feel about the UCAT? So 1, not confident at all. 2, somewhat confident. 3, confident but want to know more. Or 4, you feel extremely confident. Okay, most people saying 1 to 3s basically. Okay, fair enough. Some of you doing Medify, which is really good. That's a very, very good resource to use for UCAT questions, which is really, really nice to see. We also have 6med Question Bank, which is the UCAT Ninja and things like that. Similar, we have BMAT Ninja if you wanted to use that as well. But they have a really good level of question banks for you guys to do and practice in preparation for your UCAT. Okay, so hopefully by the end of the session, we can get more of you to a number 3 or a number 4. So for the aims for the session, it's more of sort of like a talk through, and like if you had any queries, you can ask me for this hour. I'll just be offering general advice on how to approach different sections of the UCAT, but then I'll also be offering specific advice on how to approach each section within the UCAT as well. So what are we actually doing for the UCAT? As many of you may know, it's a multiple choice question based exam. It's computer based and it covers these 5 sections. So verbal reasoning, decision making, quantitative reasoning, abstract reasoning, and situational judgment. And as we know, these are the 5 sections of the UCAT. Verbal reasoning, decision making, QR, and AR are all scored between 300 to 900, and situational judgment is scored as a band. So band 1 and band 2 are considered really good. Band 3 and band 4 not so much. It's actually really, really important to place just as much importance when you're revising with situational judgment than with the others, because it's very, very easy to abandon situational judgment, which is something that I've done when I was studying for the UCAT as well, because you think, oh, the questions seem relatively easy. But if you don't revise for the situational judgment, initially, if you think, oh, you did really well in it, I don't have to spend as much time on it. And if you neglect that, it does tend to be one of the ones that brings students down because they don't put as much importance for that section. But it is just as important as all of the other sections. And the reason why I say that is because it really sways the interviewers as to whether they should give you an interview or not. Because the situational judgment basically shows them a little bit about your personality and whether you have the qualities of a good doctor, because it asks you different scenarios, medical scenarios, and how you would deal with that. So with situational judgment, please don't abandon it to the end. It's really important that you keep practicing questions on that. Abstract reasoning, most people find a bit difficult, but the more questions you do, the easier it is to recognize different patterns. Quantitative reasoning, the main thing is mental maths. So try and do as many calculations in your head as you can. Practice using the online calculator on your screen as well. And then decision making and verbal reasoning, again, the more practice you do, the easier you get with it. Okay. Got a few questions coming in the chat, so I'll address some of them. So someone said, is the recording available? Yes, it should be available to you guys at the end of the session. It probably won't get it straight away, but sometime during next week. My UCAT is on the August 8th, but I want to reschedule it to later. I looked to other centres if they have available dates at the end of August and September, but they don't. I'm really scared. Completely understand that you might feel like you're not a bit ready, Anisha. But one thing to do is maybe contact them. They might have they have a number on their UCAT Pearson website where you book the test. If you call them and say, I don't really feel ready enough, if you're not able to find a booking date, try and ask them to see if they can find anything for you by calling them up rather than using the online tools. I think it's always better to try and speak to a person about things like this rather than try and figure it out on a laptop. So try calling them up and asking them if you're able to move. August 8th, you still have, a few weeks, so it should be okay. I always say, actually, sometimes don't leave it too much to the last minute, because what can happen is you're revising for it so much for such a long period of time that you end up feeling burnt out. So in a way, doing a bit earlier might not be a bad idea, but if you really feel like you need more time, that's absolutely fine as well. Try and call them up and see if anything can be done. So how can I maximize quantitative reasoning? Practicing lots of, we'll go through, some of these questions will be addressed in the next few slides. So we'll go through that in a bit. And then how do people actually answer the UCAT questions in a matter of seconds? It comes with practice. It really does. And I can completely understand where you're coming from. It's not a case of revising for this test. It's more a case of dealing with the time pressures. The actual test itself is not that difficult. It's doing it in, answering each question in 30 seconds, or in the case of abstract reasoning, 15 seconds. And I think it's just the more you do, the faster you recognize those patterns and you're able to pick out keywords and things like that. Is this webinar more of an introduction for first timers or specialized tips and tricks? So it's more of specialized tips and tricks. So we already have done an introduction to the UCAT the week before, and we also did it back in June. We ran the same session basically twice. Next week onwards, we have sessions where we focus on one section per week, per Sunday. So next week we're doing the verbal reasoning, and we'll only be working on questions which are for verbal reasoning, and then the week after will be decision making, and so on and so on. Abstract reasoning, yes, very difficult. I'll come to that in a second. I have 6 weeks to revise. Is this enough time? How long did you give yourself to revise for the UCAT? So I had about 6 weeks, 7 weeks. So I booked my test in end of June, and I had my test, mid-July, and I had my test in the last week of August. I think it was literally the last day of August 31st. And so I had exactly about 6 weeks. And I think that's absolutely enough time. 6 to 8 weeks is probably the best sort of balance. But at the same time, if you feel like, you're really struggling with some of the sections, always happy to be flexible in moving it later. Or if you feel like you're ready, be flexible in moving it earlier. That is obviously if you do have any dates available. So it is dependent on that as well. I've been doing practice for the last few days, but I feel like I'm not improving by that much. So I understand what you're saying. It can feel like you're doing lots and lots of questions and you feel like you're sort of getting the same kind of score. I felt exactly that way. One thing that changed the way I was revising and the way I was able to get a better score was once you get a question wrong, what a lot of students do is they don't actually go back and look over why they got that question wrong, and they don't fully understand what the reasoning is behind a different answer being correct. They just sort of skim through it, and a lot of students think that doing 60 questions per day is good. I would say that's not true. I would say stick to about 20 to 30 questions per day, and also at the same time make sure that in the questions that you go wrong, look over them again, spend extra time and spend like a few hours per day looking through what you've done wrong, which questions you've gone wrong in, and read the explanation on the answer page and try and find out. And then a week later, not a day later, a week later, do the same paper again and see if you're able to get that answer correct. So it's all a matter of quality of questions rather than quantity is what I'd say. Really struggling with quantitative reasoning. Again, we'll get back to that bit where I can give you a few tips on how to sort of get a little bit faster doing those types of questions. Okay, very good questions, guys. Keep them coming as I go through and I'll try and answer them as I go. So you may have seen this sort of table before. It's just sort of summarizing how many questions you have, how much time you have, and therefore how many seconds per question you have, basically. Verbal reasoning, a lot of people, as I said before, may find it difficult because of the long passages, and you only have 28 seconds. And similarly, the same with abstract reasoning, you only have about 15 seconds per question. But let's go through some of the tips that I found useful from my UCAT section as well. So general advice that I say to anyone doing the UCAT, if you don't know what the answer is, try and make an educated guess. Always, always, always put an answer down. Don't leave the paper blank, that question blank. Always make an educated guess, put an answer down, because then you're giving yourself a 25% chance basically of getting that question right, even if you don't have time to come back to it at the end. So always put a question and always put an answer down, flag the question, and then come back to it later if you have time. Otherwise, you'll just be wasting so much time looking through one question when you could have spent that time on another question. Learning to skim read is really important for verbal reasoning, particularly, which many of you may already know, like finding keywords and things like that, and then picking out key phrases, and make sure that you're confident and keep practicing. I know it can be really disheartening for a lot of people when you feel like, I know someone mentioned, been doing questions for a few days and doesn't feel like they're improving. I know it can be a little bit disheartening, but it is a little bit of a long haul rather than a short-term thing. So try and try absolute best not to feel sort of discouraged if you do get a lot of questions wrong, because you're just learning as you go. And hopefully it should all work out for everyone. In BR, how do you determine what you're with your inference? How do you determine what? I don't particularly understand what you mean by that question. If you could sort of unmute yourself, if you could unmute yourself and ask the question, or if you want to rephrase the question, I don't really know what you're referring to. And we'll come back in a minute. Someone said something in the chat. For verbal reasoning sections, how did you scan the passage and also have enough depth to answer the reading comprehension questions? So I'll get that is going to be covered in a few seconds about the way I do my verbal reasoning. So we'll go through that in a second. And someone else has said, in verbal reasoning, how do you determine when your inference turns into an assumption? Okay, so I think what you're asking is, how do you determine whether an answer is true or can't tell, or false or can't tell? How do you determine whether it's a can't tell or not? I think as for decision making and for verbal reasoning, the main rule is not to make any assumptions. And so if they give you a sort of statement in the passage, make sure that you're not bringing in your own knowledge of what you know about that subject. So say if the passage is about music and you know it's talking about a specific musical instrument, and if you know a lot about this musical instrument, don't bring your own knowledge into it. That's what a lot of people make a mistake on. Only ever go with the evidence that's been given to you in the passage to decide whether the statement is true, false, or can't tell. Don't ever make assumption based on your preemptive knowledge, because as I said, UCAT is not really about revising, it's more of an aptitude test. And the more practice you do, that's how you get better at it, because you have to try and understand the phrasing of the questions rather than trying and understanding content, because you're not revising content, you're revising how to answer these questions under timed conditions and in a tactical way, basically. So we'll go through some tips in a minute. Hopefully that answered your question. So with verbal reasoning, if you get given a passage, for example, so you know this passage here on the left side of the screen whenever you do your verbal reasoning section, make sure that you're reading the question first. Never, ever look at the passage, because what always happens to me when I look at the passage first is I feel really overwhelmed that there's lots of things on there, and I'm going to have to answer 4 or 5 questions on this passage, and I feel like you get lost and you start panicking a little bit. Always train your eye when you're doing these sorts of questions to go towards the statement or the question first, rather than looking at the entire passage, because that will just make you panic a lot. It makes me panic. I don't know about some other people, might do the same for you. So read the question first, and then you do get like an online highlighter, so you can highlight the main keywords that you want to sort of identify and identify those keywords, and then try and find those keywords within the text. Always start in like a chronological order, so start with the first paragraph and then look through each of them. The first question of every new passage that you get will always take a bit more time than the rest of them, but you still need to learn to scan effectively, and the way you do that, you can sort of look for the keyword, or another thing that you can do is try and find similar words to the keyword, so synonyms or antonyms, and then try and answer the question in that way. Once you've found the keyword in the text, make sure to read the sentence that that keyword is in, but also read the sentence above, so before it, the sentence before it and the sentence after it, because that will give you a bit of context as to whether the statement is true, false, or can't tell. So just reading the statement with your keyword in may sometimes trick you, and the second line, the line after that, might give you a little bit more information, which may change your answer from a true to a can't tell, for example. So always read the sentence before and the sentence after, the sentence where you have the keyword in. And then answer your question and try and scan the passage effectively. And then, as I said before, flag, skip, and come back to the question later if you're really struggling with verbal reasoning. Okay. With decision making, a lot of people, it's mixed really. Some people really like it. Some people really hate decision making. It's more personal preference. You do get, I don't know if many of you know, but for your UCAT exam, you do get a whiteboard. So, but you get a pen, which is non-erasable. So any notes you make on that small whiteboard that you have will stay on there. You won't be able to wipe it out at the end. So use small amounts of space, because you will need the whiteboard again for quantitative reasoning if you're doing sort of small calculations or something like that. So use your whiteboard, use small bits of spaces there, and make sure you have enough whiteboard space for the rest of your calculations later. And write down key information. What I mean by that, some of you might have come across syllogism questions, where you get questions like, all my jumpers are red, this jumper is blue or red, and then you have to answer if the conclusion is yes or no, basically, based on what they've said. So when you do that, you can write a little code for yourself just on the whiteboard to say, all my jumpers equals red, all his jumpers equals blue. And then using that code, you can try and answer the rest of the questions rather than panicking and constantly reading the long sentences that's been given in your question. Make sure with decision making, unlike with verbal reasoning, you don't skim read the text. Because with decision making, the text that you've been given, the statements, are already small enough, and you need to understand all the information you've been given in order to decide whether a conclusion is true or false, or yes or no, for example. Sorry. And again, same as verbal reasoning, try not to make any assumptions. With decision making, you can have a few, 2 or 3 usually, they give you Venn diagram based questions. Make sure that you practice how to draw Venn diagrams and where the right numbers go and things like that. This will just make your life a lot easier. It's a lot of GCSE maths knowledge, but if some of you aren't doing A-level maths, for example, it is important to try and go back and revise those kind of things. And then flag, skip, and come back later. Again, same as the other ones as well. So let me answer this question. So one question type is, which of the following is true, not true, etc. In that case, you have to find keywords for 4 different statements. How do you do this without spending 4 times the amount you would for a true, false, can't tell question with one key term? Yeah, so I know which kind of questions you're talking about. You're talking about, so there's true, false, can't tell questions, and then there's single best answer questions where you get given 4 statements, and then you have to identify which one's false or which one's the only one that's true, for example. So I know which questions you're talking about. It is hard because those statements, in each of those statements, you have to identify keywords. But again, they'll give you an overarching statement which covers the information within all the 4 options that you've been given to answer the question. So I'd say look at the overarching statement, find the keywords in that, and then find the paragraph where they're talking about that particular topic. And then go back to your 4 statements and identify keywords there. So that's the way I do it. I know it is a little bit more complicated, and it's just the way it is, the way they've designed those questions, and it does take a little bit longer. But again, the more practice you do, that's the only way you can get better at it. And if you follow this sort of keywords technique, hopefully it should be able to help you. Okay, so with quantitative reasoning, as I said before, make sure you practice mental maths. A lot of students try and they don't actually use the Pearson calculator, the online calculator that's been given. But I would say from the first day that you're doing quantitative reasoning, please use this online calculator, because that's the only thing that you'll have. And obviously when you're in a panic mode, when you're doing your UCAT exam, your official exam, you might sort of doubt yourself in terms of what is 2 plus 2 or 3 plus 3, for example. And I know I've done that in GCSE maths exams and stuff like that. So just having the reassurance of knowing how to use that calculator really well is good, because then you'll know, okay, I have the calculator, and it puts your mind at ease a little bit, so you can double check your answers. Remember that with the Pearson calculator, you can't, there's no fraction button. It's a very, very simple calculator. So make sure in your head you have practiced being able to calculate fractions into percentages, fractions into decimal, for example, especially for probability-based questions and things like that. So just practice those questions in your head. With quantitative reasoning, what a lot of students tend to do is if they've finished a problem and they feel like, oh, they're not really sure what the answer actually was, and they put down C. And then when they move on to the next question, what a lot of students make the mistake of doing is they keep thinking back to the question that they've already done, which means that you're wasting time and you don't have your full concentration on the question that's in front of your screen, which then ends up meaning that the rest of the exam that you're doing for quantitative reasoning and for the rest of the UCAT exam, you might not be paying your full attention because you're just thinking about that one question. Remember to just completely forget about it. And then if you have time, you can come back to it later. So that's something that you really need to train your brain to do, because in general, when you're panicking, you'll constantly be thinking, oh, what was that question? What was the answer again? I should be thinking about it in the back of my head. And it's actually quite a bad thing to do, because then it can bring down your overall mark for the other sections as well. And it often happens with quantitative reasoning when you have specific calculations to do, or when you're trying to remember a formula, for example. So yeah, the main thing I'd say with quantitative reasoning, don't panic and try and stay as calm as you can. Make sure you know how to use the calculator and things like that. One thing, you might have seen this in last Sunday session, and you can make your life so much easier if you remember certain formula. So from your GCSE physics, you can easily remember speed equals distance divided by time, and you also know distance is equal to speed times time, and time is equal to distance divided by speed, things like that. Things to just make your life a little bit easier, so that you're not wasting time and trying to think about those formula, which you can easily remember if you just sort of prompt yourself every time you're doing quantitative reasoning practice. And with areas of shapes and things like that, so for example, area of a circle or area of a sphere, if you remember those formula, it makes life again easier, because they could give you questions where they're like, one cylinder of paint paints this much area of the wall. How many paint boxes does this person need to paint this area of this room, for example? So it could ask you something like that, and just remembering the areas and volumes of each of these things, it makes your life a lot easier. So going back over your GCSE maths is very, very useful. This formula is probably one of the most key ones to remember. I know I had to remember it for GCSE maths and physics and stuff. Conversion between miles and kilometers, commonly asked question in quantitative reasoning. So they may give the distance in miles, but they may give the speed in miles, in kilometers per hour, or meters per second. So being able to convert meters to kilometers and also kilometers into miles makes your life a lot easier. So you can easily remember it as 1 mile is equal to 1.6 kilometers, or 5 miles is equal to 8 kilometers, whichever one you prefer. With probability, there's 2 rules. So when you're, and then there's 2 probabilities, and there's the word "and" in between them, as in the probability of picking out a red and the probability of picking out a blue ball, and you're trying to work that out. Whenever you see the word "and," make sure you multiply those 2 numbers together, those 2 probabilities. And then whenever you see the word "or," make sure you add the numbers. And that's a rule that a lot of people, it's quite a simple rule, but a lot of people can easily forget it when they're panicking. So for example, if you say, what's my probability of picking out a red ball or a blue ball, you would then add those 2 numbers together to get your overall probability, if that makes sense. So those are just some key formulas to remember. So got a few more questions. When you skip a question in quantitative reasoning and the next one is similar, should you skip to the next set of questions or just that question? It really depends. So sometimes the next question, which is based on the same problem, you might need the answer from your previous question to use in this next question. In that case, I would skip the whole set. If you don't actually need to use the answer from the previous question, then feel free to try and answer that question. If you can't, just flag it and come back. So yeah, it's really dependent on the question. Is that assumed knowledge, or do they give you the conversion in the exam? They don't give you the conversion in the exam. They don't give you the conversion in the exam. It's something you have to remember. I think for things like weird conversions, like converting micromoles to moles and things like that, if they have a question like that, they might give you a conversion. But for miles and kilometers, normally they expect you to know that one. How many questions is it okay to skip in each section? Anything that you're finding really, really difficult, skip it and come back to it. Just try not to make sure that you're just ending up skipping every question, and try your best to make an attempt at answering some of the questions. It's very easy to feel disheartened if, for example, the first question is one of the hardest ones, and then you're sort of constantly skipping it and you're like, oh, I don't feel like I can actually answer any of the questions in this exam. So I completely understand that, but try and read the statement and sort of calm yourself down, especially within those first few minutes when you start that exam, because I was definitely very, very anxious and I was sort of panicking all over the place. I had to just stop for a second and read the question and remind myself this is just like any other mock exam. One way to sort of reduce that panic and that anxiety is if you find your local library where they have computers very, very similar to the Pearson the computers at the Pearson View Test Center. The reason I say that is it mimics the environment that you'll be in when you're doing your actual UCAT exam. So doing it on it's usually an old computer, so doing it on one of those PCs in a library, because it mimics that environment, it's almost like a mock exam for yourself. If you do a few mock exams before your actual UCAT exam in a library, it should really help avoid those nerves that you get when you first go into the exam. Okay, so abstract reasoning. Ella might have gone over this with you guys last week anyway. So it's important to identify the pattern. The way we teach it is SSSPN. So shape, size, shading, position, and number. So does set A have the same shape? Is it all curved shapes? And then set B is all straight shapes, for example. And then, or is the pattern size is is a triangle always bigger than a circle, for example? So a size relative to another shape. And then shading, again, is a square always shaded in set A, and is a circle always shaded in set B, for example. Position, so is the shape in the corners or is it in the middle, for example? And then finally, number. So number is a bit complicated because you can have different types of patterns within number. So you can have different number of sides, whether they're even or odd, for example, or you can get number of points, so how many points there are. So for the start would be 5 points, so it's an even number of points, odd number of points, for example. Or is there a certain number of right angles, obtuse angles, acute angles? And then what's the other one? Number of areas that are there as well might be one of the pattern. And then once you've identified a pattern in set A, try and see if you can find a similar pattern in set B. And then if you really can't, if you're struggling, try and flag the questions or the set of questions for that section of abstract reasoning, skip it and come back later. I know this one you're very, very limited to time, so it's 15 seconds per question. Sometimes it's just really difficult to find a pattern. If you're really struggling, just put an answer down and come back to it later. Is SSSPN a preferred acronym to scans? I think it's sort of the same, isn't it? Shape, color. I don't know what A would stand for. Angles, I'm guessing number, and then shading. So it doesn't really matter. They both sort of cover the same kind of things. So it doesn't matter which acronym you use, whichever one you prefer, really, Arjun. That's up to you. So as I said, shape, size, shade, position, number. And then within number, you can have sides, whether they're even or odd, corners and points, areas, or acute, obtuse, right angles. So I'll leave the screen out for a bit if anyone wants to sort of make notes of the common patterns that usually come up. So about 30 seconds, and then I'll move on to the next slide. If anyone in the meantime has any questions to post in the chat about UCAT, feel free to do that and I'll try and answer those. Okay, I'll move on to the next one. If anybody else wants me to go back to that slide at the end, please ask and I'll try and go back to that session. Someone's asked a question. How do you know when you're ready to take the exam? A bit of a tricky question, really. It's dependent on the individual and how confident you feel. You should be nervous for the exam. Anyone would be for any sort of exam like this, because it is a lot of pressure, and it's sort of determining whether or not you get offers for interviews. I completely understand people who do feel nervous about it. When you know you're ready, that's really sort of dependent on you. For me, I felt ready after about 4 or 5 weeks, because I felt like I had enough practice, and I just knew if I was going to carry on doing UCAT practice and delaying my exam until September, I just knew I'd get really burnt out. So I preferred to do it earlier than later. And another thing that sort of made me book my test in August rather than in September was the fact that you're going into year 13, which is already a really stressful year, and you're doing your UCAS application. You have to write your personal statement in September. It's very, very stressful and a lot to deal with. And I sort of wanted to get the UCAT out of the way, so I had more time to focus on my A-levels. Because at the end of the day, your A-level grades, the grades that you get in August the following year, is what decides whether or not you're getting into medical school. So focusing on that is just as important as focusing on this UCAT exam. The UCAT exam is one part of your entire medical school application. So because I knew I couldn't sort of tackle so many different things in September, because on top of that, I was also trying to organize some work experience, I just knew it would be better for me to do it in August. So it's entirely up to you and when you feel ready. For me, it just happened to be 6 weeks at the end of August, when I knew I'd have a bit more time to get all the revision done and feel confident enough to do the exam when I'm not in school. So hopefully that helped. When should I start doing mock exams? When you've timed yourself doing each of the sections and you're happy with the times that you're able to do each question in, then I would say do a full mock. I think probably about 3 weeks before your UCAT exam, do your first mock exam. Okay, sorry. Before you start your UCAT revision at all, do one exam, one practice paper to see what your baseline is. And then after that, and remember, you will get a lot of them wrong, because obviously you haven't spent as much time answering these questions. After you've done that initial mock exam, use that as a baseline to compare all your other scores to. Then I would say probably 3 weeks before your UCAT test date, do your first mock exam on the Sunday or something. So Monday to Friday, just do some practice. Saturday, have a break, and then Sunday, do the mock exam. And then the following week, do another mock exam again on that Sunday. And then the third week, so the week right before your UCAT exam, whenever your date is, make sure you do the exam 4 or 5 days before your actual UCAT exam. You don't want to leave it right to the last minute, because what can happen is, say if you did a mock exam the night before your UCAT exam and you didn't do as well because you're quite nervous, that can actually discourage you a little bit. So I would avoid doing lots of questions the night before the exam. Try and make sure you relax, get a good night's sleep and things like that. So yeah, mock exams, do one at the beginning before your UCAT, before you start revising for UCAT in general, and then do one 3 weeks before the exam, and from then on, one every week until your UCAT exam, basically. What are some things of note that I should expect or look out for and keep in mind on test day? So one thing is, make sure they'll have given you an email when you book your test. Make sure you have your booking reference, all of that admin stuff sorted out, so it's not a headache in the morning. What I did was, just to be safe, I printed out a copy of the reference number and just handed that over to them. You can bring a small bag with you and a bottle of water. You can't take the water into the exam, obviously, because it's computer and you might have an accident, water all over the computer and things like that. So you can't take it in, but any sort of snacks for afterwards while you're waiting for your results, or a snack before doing your exam, probably useful to take in, especially if you get really nervous. Make sure you wake up a little bit earlier than normal, so you're not panicking, get there in time, things like that, just general stuff that you normally would do before any exam. And other things to note on the day of the exam, just familiarize yourself with the area. So you do get given, it's when you click the button on the screen, that's when the exam starts. Take a few seconds to adjust your chair, look around. So you'll have sort of like a little cubicle, and then just your computer in front of you. Just take a minute to look around your surroundings, get used to that environment, so you're not clicking that button and then feeling really panicked and thinking, oh no, I've started the exam now, my chair's not adjusted properly, or things like that. So yeah, that's the kind of advice I'd give. Okay, situational judgment. Make sure to read the GMC guidance to good medical practice. I don't know if you guys have heard of that, but if you just put it on Google, GMC guidance to good medical practice, it's a very short document on with a bullet pointed list to basically say the qualities of a good doctor and professionalism, and what you would have to do if something had happened with a colleague or something like that. It teaches you what a doctor would do. Now, this document is probably really, really useful, not just for your UCAT, but also for your interviews, when they give you role play scenarios and ask you what you would do in the situation and how you would break bad news, etc. So reading that can help guide you in how you approach situations that they give you in situational judgment, and whether you would put very important or very unimportant, or very appropriate or very inappropriate. I always say this to my students. A lot of people struggle as to whether the answer, if they've decided the answer is appropriate, they then struggle to put either A or B as the answer. So very appropriate or appropriate, or they struggle to put C and D. So they're not sure whether to which level of appropriation is useful, is the right answer, sorry. So most of your answers are extremes. Most of them will be, 70% will be either very appropriate or very inappropriate. So what you need to do whenever you get a situation judgment question, look at the scenario, look at what the question's asking you, and then decide. First of all, ask yourself, is this appropriate or is it inappropriate? Once you've determined that, the next thing you need to do is, well, is this response very appropriate or is it just appropriate? And the way you distinguish between those two is to see how quickly that decision needs to be made. So for example, if you get given a scenario saying one of the medical students has turned up drunk to placement, and they said they're going to stay on hospital and they're going to look after patients, and then your statement is asking you to say, what would you do in this situation? Do you think it's appropriate to sort of report this person to someone senior? And I would say that that is appropriate, but not very appropriate. So very appropriate because it's timely, because in the time that you sort of leave it and you let that person go and see that patient, they might make mistakes which can then compromise patient care. And obviously that's a very, very serious offence and goes against professionalism. So it'd be a very appropriate thing to do, to go and speak to someone senior about what's going on, and to make sure that that individual, that student, is not imposing a risk on the patient, for example. So that's what I mean. Again, situation judgment, usually people find it easy once they start doing lots of questions. But if you really are struggling between the answers, try and flag, skip, and come back later with your answers. So that was all the main tips. So will you hear the other candidates typing or working during the test? Yes. That's some background noise that you do need to get used to. And there'll be lots of people doing either the UCAT test, or some of them will also be doing the driving test, because it's done in the same test center. The Pearson Test Center does both exams. So yes, it is a little bit unsettling that there's lots of different people in there, and people will be walking out and walking in. So new people will be walking in to do their exams, and old people will be walking out after they've finished their exams. So yes, you do need to sort of get used to that level of background noise, which is why I say going and doing mock exams in libraries can really help you get used to that environment, because it's quiet. It is quiet, but you can hear typing, people getting up, people coming in, things like that. So it's something you do have to get used to. Okay, so that was the last slide in terms of tips and everything. Now, on a scale of 1 to 4, how do you guys feel now about the UCAT? So not confident at all, somewhat confident, but you still want to find out more, or you feel a bit more confident in the beginning? Perfect. Yeah, perfect. Yeah, I think it is just comes, the more practice you do, the more confident you feel at it as well. So perfect. Okay. So thanks guys for being really great and asking lots of questions in the session as well. I'll just open the floor to any other questions you may want to ask. We have about 15 minutes, so let me know what you guys want to ask me. What happens after you finish your test? You just stand up and leave, or wait until you're told to leave. You just get up, you take your whiteboard and your pen with you, and make sure that you've obviously pressed submit. Some students have not done that, and then obviously you have to go back and make sure that all the answers are saved and things like that. So make sure you double check that everything's submitted, and it should basically say on the screen, you're now done with the test, you can leave. So take your whiteboard, take your pen, and then you can just get up and leave. So right before you enter for the exam, the person who at reception basically will show you where the exit is and things like that. So they will let you know, so you can just get up and walk out. You can go up to the person at reception and you will say, you'll probably say something like, I finished my test, and then they'll print out your results for you. And that's about it. Yeah, you get your results immediately as well, which I think is very good, because then unlike BMAT, where you don't get your results immediately, you have more of a little bit more power in terms of what kind of universities you want to apply to, because some people who've done really, really well in the UCAT can apply to universities where they place more weighting on the UCAT to increase their chances of getting an interview. People who feel like they haven't done as well, could have done better, can then readjust their choices and then apply to be tactical and apply to somewhere where they don't place as much importance on your UCAT score. Do you have any tips for the syllogisms in the decision-making section? Yeah, so with syllogisms, the main thing is to write a little code, like I said before. So for example, like the example I gave before, all my jumpers are red, some of your jumpers are blue, but none of them are yellow. What would, this jumper is either yours or mine. So with that, you can make a short code. You can just say, my jumpers equals red, some of your jumpers equals blue, no jumpers are yellow. So you have those 3 little bullet points, and you made yourself a little code, and then that helps you answer all of the questions. Syllogisms are generally quite simple and easy to get your head around. It's just trying to understand the way the sentences have been written, because they can try and trick you with the sentence structure, so be careful with that. Okay, if anyone has any other questions, feel free to let me know, and I'll try and answer them. We've got about 13 minutes left. If you're happy with everything, feel free to log off and enjoy the rest of your Sunday. Is getting in the low 600s a good starting point? Yeah, it's absolutely fine. Remember when I first started revising for the UCAT, got very, very low scores, very low scores. And the only thing that can you sort of do need to kind of encourage yourself and say, okay, this is only my starting point. I still have 5 weeks left. I still have 6 weeks left until the exam. And you can sort of, like, you do have to reassure yourself a little bit, speak to your parents about it, speak to your friends and family, and just make sure that you're addressing any worries that you have in the beginning, because if you're sort of panicking right at the end, that just makes test day even more stressful. So in the low 600s, absolutely fine to get that in the beginning, and then you can work your way up slowly with more and more practice. That's fine. What did you score in the UCAT, and how did this impact your decision to apply? It's been about, so I applied in 2017 for the 2018 entry, so it's been four and a bit years now, so much older than you guys, but I can't remember. I think it was an average of 670 across all the sections. I know some people who have got really, really high, like 700s, 780 in my cohort, and I think it also just depends on how you revise and things like that. So mine was about 670, 680. I can't remember the exact number for the overall score, but that was my average. It did impact my decision to apply, because at the time, Edinburgh was going to be my top choice, and they needed a really, really high UCAT score, and it's a very competitive university, because at the time, it might have changed now, I'm not too sure, but when I was applying, they didn't have interviews, so it was solely based on your UCAT score, and it was based on your personal statement and your predicted grades. So I had to sort of not apply to Edinburgh and be a bit more tactical, so I ended up applying to Bristol and Cardiff, which didn't place as much weighting on the UCAT. And then I also applied to St George's in London and King's College London as well. So 2 London universities and 2 non-London universities, because in general, London ones are a bit more competitive as well. So I was just trying to even out my chances of getting interviews. A lot of abstract reasoning questions don't fit into SSSPN and they can be more complex. How do you tackle those questions in the time? Every year, UCAT, the people who make the questions for UCAT are a little bit sneaky. They might try and introduce a really complicated pattern. I had one which was very, very complicated. It was my last set of abstract reasoning questions. I just couldn't figure out the pattern. If that happens on test day, just put an answer down. Try your best in the time that you've been given to identify a pattern. If they don't fall into any of those categories, flag it and come back, because always when you're in a panic, you might not see the pattern straight away. So when you come back to it later, you might not. And that's like kind of the risk with abstract reasoning, really, because if we don't do much of it in school, so we're not really prepped for it until we start revising for the UCAT. So I would just put an answer down anyway and try and make an educated guess and go from there. So yeah. In quantitative reasoning specifically, I'm finding it tricky to manage my time. Do you have any tips for time management for the section? Yes, so as I mentioned before, Pearson calculator to try and do complicated calculations on there. One thing that I was taught when I went to a course like this, it was, say if they don't need an accurate calculation number, because a lot of the time the question will be something like, choose the answer closest to the value that you've calculated. It might not be the exact answer you get. So with that, what I tell my students to do is round up or round down. So if you had a number like 583, for example, I would round it up to 600, because it's much easier working with those numbers rather than working with 583 when you're doing multiplication or division, for example. And even addition, it can just make it a lot more easier in your head. And similar, like if you want to round up to the nearest 1,000, for example, if you're on 6,800, and then you can round up to 7,000, or round it down if it's less than 5,000, for example. If it's 4,100, you can round it down, things like that. I think rounding down, rounding up can really help, and then you can get a good estimate of what your answer might be and then choose the answers. So yeah, that can save a lot of time. Not good at maths at all, struggle lots with quantitative reasoning, probability. Do you have any advice? So the rule that I mentioned, the and the or rule, is what most probability questions are like. I think it might be worth maybe going to what I did for mine. I spoke to my GCSE maths teacher, so I didn't take A-level maths. So obviously it had been a year of me not doing maths at all. But I did do physics, so I do remember some of the calculations, but like some of the key calculations and things like remembering area of a sphere and things like that, you do forget it after you've done your GCSEs if you don't take it for A-levels. So just speak to one of your teachers, say you're doing a UCAT exam, say, can I have a few like past paper, GCSE past paper questions? And then can I come back to you and ask you a question if I get it wrong and something like that. Speak to teachers, use your parents, or use your brothers and sisters if they find quantitative reasoning or maths in general a bit easier. So ask for help, basically, and also ask for ask different people to help you with the way of thinking with quantitative reasoning. A lot of abstract reasoning. Okay, answer that question. Next one. What kind of mock score should you be confident with? Now, this can vary based on how close you are to your UCAT exam. So what happened with me, I was doing very, very well in my mock exams, and the final mock exam right before my UCAT official test didn't go very well. And I was very glad that I did it sort of 4 or 5 days before my exam, because I did feel discouraged in the beginning, but then I still had that 4 or 5 days to sort of look through the last few questions that I didn't do so well in. And for me, my weaker section is abstract reasoning. So the kind of mock score to be confident with is probably, the average score last year was about 620 per section. So 620, 630 is probably a good mark to start with for your mocks. Is there anything else of note it would have been nice to know for the test day? I think apart from what I've said, nothing else really, just sort of trying not to stress too much. I know it's easier said than done. try and take a few snacks with you, just make sure that, and remember, it's not the end of the world if it doesn't go as well as you expected it to, because there are still lots of universities who don't place as much weighting on the UCAT. And that varies with year on year. So you would have to check online which universities are weighting the other aspects of the application more so. So it's, yeah, so I think it's just a little bit of encouragement and trying to be confident in yourself. And you should be okay. I can't seem to enter numbers in my placement calculator with the number pad to the right of my keyboard, but only with the one on the top. Is there a specific key I need to press to access it? If you go on the UCAT website, there should be a UCAT tutorial to teach you all the shortcuts. That's a very good point, actually, Xander, because I didn't know until about 2 weeks before my exam, but on your keyboard, you can actually use a lot of shortcuts to, rather than using the mouse to drag it all the way across the screen and try and click to next question, etc. If you do Shift N or Shift P for previous question and then Shift N for next question, it does save you a little bit of time, maybe a few seconds, which might then be useful in a section like abstract reasoning where you don't have enough time. Yeah, that's the kind of thing. There's a tutorial on the UCAT website on how to access all these shortcuts, so I'd have a look there. No problem, thanks guys. If you don't have any questions, feel free to go and enjoy the rest of your Saturday. I will stay on for 4 more minutes and then we should be all done. So if you have any other last minute questions, doesn't have to be about UCAT, it can be about other things, feel free to ask. What course did I intercalate in? It's called BSc, Bachelor's in Medical Sciences with Endocrinology at Imperial College in London. So that's what I intercalated in this year. So it's everything to do with hormones and things like that. That's what endocrinology is. No problem, guys. Have a good day. Anyone else have any other questions? Oh, I've got something in the chat. How's the environment at hospitals as a medical student? I'd say first and second year is not, I didn't enjoy it as much. Other people did, because first and second year, so I go to Bristol. First and second year is more sitting in lectures and then sort of doing CBL, case-based learning, group work. It was good, but you didn't get to see as many patients. The one thing that Bristol and Cardiff both do, they have very similar medical school structure. In your first and your second year, from your first week, every Thursday, you're in GP placement. Every other Thursday, sorry, so every fortnight, you're in GP placement. And then the other week where you're not in GP, you're in hospital for a half day, basically. So you do get clinical practice, but it's when you come to third year where you get your basically your full time that you're at university, you're spending in hospital, and you learn from the doctors there. And that, I think, was the most fun part for me. And the reason why I say that is because you always learn better from patients than from a textbook. You just remember things a lot easier. So I really liked the hospital environment there and the way they taught. And Bristol do it really well because they've got 8 different hospitals that different students get sent to. And I was in Swindon, and then I was in North Bristol, so in Southmead Hospital. And it was really nice because you get to meet different people in your cohort, but you also get to experience what different hospitals are like and what the trust is like. So it's a really nice way to sort of learn, but also get to know different people in your cohort. And I think it's a lot less sort of rigid in terms of you have to sit for lectures and like people talking at you, and you're not really learning as much. Whereas when you're in the hospital or on GP placement, I think because you're seeing the disease yourself and you're seeing how it's affected the patient, it's really sort of interesting, because I definitely found it easier to learn that way than sit in lectures and be talked at. So yeah, mine, I was lucky to go to Bristol because there's a really nice sort of mixed course where you have both hospital placement as well as lectures. But I know some universities are a little bit more traditional, where they do 3 years of lectures and then a science year, so an intercalated year, and then they do sort of 2 years of clinical. But for me, learning from patients is what works best. So it's also up to you guys in terms of what you think you'd learn best from, whether it's seeing it in a patient and that's how it will stick in your head, or whether you are actually one of those people who are able to pick up a lot of stuff from lectures. But yeah, it is quite good, and you get a lot of support as a medical student. Everyone wants you to learn and wants you to do well, so it's a very, very supportive environment. So it's quite nice. Okay, so if there aren't any more questions, I will log off, but thank you guys for being really interactive, asking lots of questions about the session. Good luck to all of you for your UCAT, and hopefully I'll see some of you in the future if you apply to Bristol. I might be in my final year, but I might see some of you as well. So yeah, good luck with everything, and hopefully all your UCAT stuff goes well and your medical school applications as well.